You jump out of bed and get going on your normal morning routine. You are on your feet and going non-stop all day until you get back home in the evening. You plop down in your favorite seat and begin to get in relaxation mode. What are you relaxing? You're relaxing the muscles and bones that were hard at work moving you around all day. Everything you did for the day can be summed up into one word: body mechanics. Body mechanics is the movements of the bones and muscles to cause changes in posture and motion. Let's go back to when you were at work. You were in complete control of your musculoskeletal system and moved your body around without any problems or issues. When you work as a nurse, you will be helping your patients with their body mechanics. In this sense, body mechanics refers to the exercises to improve posture, coordination, endurance, and physical abilities. Patients that are immobile will need complete assistance with body mechanics, while other patients may have limited mobility and need minimal to some assistance as well. Let's do a quick refresher on some main parts of the musculoskeletal system. The first part of being able to move around is having some type of structure to support everything in the body. That is the function of our bones. They are the reason why we are able to stand and sit without being one big glob of skin, muscles, and other organs. We are lucky that we are designed with joints in our skeleton. These bone junctions allow us to be able to do things like bend our arms and legs and move our necks. Joints allow for fluid movement. Think for 1 minute what it would be like to try to walk without being able to bend your legs at the knees. That would be very difficult. Could you imagine trying to run without bending your legs? Bones don't move on their own. The skeletal muscles are what move the bones of the skeleton. The skeletal muscles contract and relax, which causes whatever part of the skeleton to which they are attached to move as well. The muscles are responsible for every movement that you make. Even the movement of your eyes are carried out by skeletal muscles. Ready to learn how you're going to assist your patients with body mechanics? Great! You will commonly do what are known as range of motion, abbreviated as ROM, exercises with your patients. These are exercises that move the various joints through their entire range of movement. ROM exercises prevent stiffening of joints and preserve joint function for patients with limited or no mobility. Nurses help their patients through the range of motion by doing things such as extending and contracting the arms and legs, pivoting the neck around, circling the arms at the shoulder joint and legs at the hip joint, flexing the foot and moving the arms and legs away from and toward the body. Assisting patients with positioning or body orientation is another body mechanics exercise. When a person is completely immobile, they aren't able to change the position of their bodies on their own. You will assist by helping patients to sit up, stand up, lie down on their back, turn on their sides, prop their legs up, and hold items in their hands. These exercises help to maintain muscle strength, keep bones from becoming brittle, and maintain correct curvature of the spine. Having patients hold on to items with their hands helps to prevent the hands from becoming deformed and non-functioning. Ambulation or walking is another exercise that you will assist your patients in doing. Ambulation is important to help maintain muscle and bone health and strength. Walking is something that moves the entire body and therefore prevents loss of muscle and bone mass, as well as the development of contractures, which are when muscles, tendons, and ligaments shorten and become hard due to a loss of elasticity, leading to joint deformity. There are a few different options for assisting with ambulation. Nurses offer assistance through the use of assistive devices such as walkers and canes if the patients are strong enough to use them. We have taken some time to learn how you will help to preserve your patient's skeletal muscles, joints, and bones. First, we did a quick review of the functions of the main parts of the musculoskeletal system. We know the bones give structure, joints allow the skeleton to bend and move, and muscles move the skeleton. Next, we discussed body mechanics, or the movements of the bones and muscles to cause changes in posture and motion. In nursing, you know that body mechanics refers to the exercises to improve posture, coordination, endurance, and physical abilities. The body mechanics that we covered are range of motion, abbreviated as ROM, exercises that move the various joints through their entire range through which they can move, positioning, which is body orientation, and ambulation, which is walking. We then covered the purpose for body mechanics, which is to maintain muscle and bone health and strength, maintain flexibility, prevent deformity of joints, and decrease the likelihood of loss of function in a musculoskeletal system. Ambulation also prevents contractures, which are when muscles, tendons, and ligaments shorten and become hard due to a loss of elasticity leading to joint deformity. Receives a briefing of the patient she'll be in charge of that day. Several patients are immobile or have limited mobility. Julie immediately realizes that she is going to need to use her knowledge of body mechanics to prevent injury to herself and the patients. Body mechanics are the movements of bones and skeletal muscles to change position and posture. In nursing school, Julie learned that body mechanics includes moving, positioning, and ambulation of patients. Ambulation is the moving of patients from place to place. Body mechanics are used when making beds, lifting patients, assisting a patient in walking, and carrying out other procedures like transporting medical supplies and equipment. Julie is very aware of how important body mechanics are to the patients since they are not able to move themselves around as needed. She also knows that body mechanics are important for her as well. Practicing good body mechanics can protect her own body from possible injury. In this lesson, we'll explore body mechanics guidelines that nurses like Julie should follow when handling patients. The first guideline is to determine how much help a patient needs when moving. Some patients are able to bear some of their own weight, while others cannot. Some patients only require assistance when moving in bed. For patients that are completely immobile, it may be necessary for Julie to request assistance from other nurses or use patient handling devices such as a hydraulic lift, sling, or other patient lifting equipment. This may be especially true for heavy patients. Another guideline that Julie needs to follow is to put the patients at a comfortable height when working with them. For most people, this usually means having the patient at waist level. This helps to eliminate the back strain from bending over to help a patient that is in the bed. The next guideline is closely related to the last one. Avoid leaning and stretching when you are working with patients. Julie can meet this guideline by keeping the patients as close to her body as possible when moving them. This guideline is helpful when you are working with patients in the bed or chair, as well as when you are moving them from one place to another. The next guideline is to get into a proper stance before you start to move or turn patients. Julie needs to make sure her feet are about shoulder width apart with one foot a little in front of the other. This gives a wider base for her to work with and distributes weight more evenly on her body. The patient should also be positioned in a manner that distributes their weight evenly as well. It is also important to keep your lower back in a neutral position. This means that your lower back should not twist or bend when working with patients. Following this guideline will prevent most back muscle strains and injuries. Keep in mind that movement of your body should take place in the legs and hips only. Your back should stay pretty well aligned as you work. It is extremely important to follow the guidelines of using the large muscles in your legs for lifting and moving patients. This will help Julie to not use her back muscles, which can cause a back strain as well. Bending the knees when lifting and closely adhering to all the previous guidelines will force Julie to use her legs to lift. Let's review. In this lesson, you learned that body mechanics is the movements of bones and skeletal muscles to change position and posture. Body mechanics involves moving, positioning, and ambulation of patients. The guidelines for implementing body mechanics are as follows. Determine how much help a patient needs when moving and use assistance or devices when necessary. Put the patient at a comfortable height when working with them. Avoid leaning and stretching when you are working with patients. Get into a proper stance before you start to move or turn patients. Keep your lower back in a neutral position. Do not twist or bend your back. Use the large muscles in your legs for lifting and moving patients. These guidelines should be followed every time you work with patients to prevent back strains and other injuries to yourself and the patients. Physicians diagnose what is happening with the patient and give a plan of action to help patients return to a good, healthy status. As a nurse, you will be responsible for executing the plan put forth by the physician. One intricate part of the plan may involve helping immobile patients move. This may seem minor until you think about everything in the body that is dependent on moving around. Have you ever had a moment in life when you just could not move? If you haven't, then consider yourself lucky. Not being able to move means more than just not being able to go from point A to point B on your own. The circulation of blood through the body depends on movement. Being able to have regular bowel movements is dependent on your body moving around. Having and maintaining strong bones and muscles happen as a result of your body moving around. You are going to help your patients to move around so that they will still have the benefits of body movement even though they cannot move their bodies on their own. We are going to look at some different types of movements, why they are important, and what you as a nurse can do to help immobile patients. Immobile patients are either in a bed or wheelchair at pretty much any given point in time. Patients that are completely immobile may not be able to do something as simple as push themselves up into bed. This is where you, as their nurse, come in. We want you to assist the patients in a manner that is safe for them and for you as well. Here's how it should go. If you are working alone to move a patient up into bed, then this could put more strain on you depending on the weight of the patient and your strength. You should request the help of another nurse to move patients up into bed. It is always easier to move patients when the bed is flat and at waist level. There should be a slide sheet or bed pad under the patient. You and the other nurse will stand on opposite sides of the bed. Both of you will grab the sheet that is under the patient at the top and bottom end. On the count of 3, both of you should move the sheet towards the head of the bed, which will move the patient as well. Remember to slide the sheet rather than lifting and moving the sheet. While it may be tempting to move a patient up into bed alone, it really should be avoided for everyone's safety. If you are dealing with a small or light patient, though, it is possible to move the patient properly on your own, but you should still use a slide sheet or bed pad, and the bed should still be flat and at waist level. Stand at the head of the bed and pull the sheet toward you. This will bring the patient closer to you. Turning patients in the bed is very important for patients that cannot move on their own at all. When patients are in the bed for extended periods of time, this puts pressure on the bony areas of the body and can cause decubitus ulcers, also known as pressure ulcers, to form. These are bed sores. Turning patients at regular 2-hour intervals helps to prevent the development of bed sores. You and other nurses will have to assist patients by turning them when they cannot do so themselves. There are 3 different acceptable positions for immobile patients to lay in the bed: on their backs or on either side. Never place immobile patients on their stomachs. This could possibly lead to suffocation and death. There may be exceptions to this rule, but it is usually by the order of the physician, and the bed is set up differently from normal. Ambulation refers to standing and walking. Nurses coordinate the different aspects of patient ambulation and may include physical therapists to assist with ambulation goals. Now, you may hear ambulation used to refer to moving patients between facilities. That is something a little different from what we are discussing here today. You will learn about doing that at another time. We are going to discuss standing and walking since they go hand in hand. Patients should stand up and start walking as soon as it is safe for them to do so. When a patient has a stroke, falls, or has certain surgeries, they may have had a period of time during which they could not walk. This period of not walking allows the muscles to get weak and the bones to become brittle. The longer the patient is not walking, the worse these conditions get, and the harder it becomes to return to walking when the time is right. Nurses can help to shorten this period of inactivity by assisting patients with walking. You, or an assistive device such as a walker or cane, will have to help bear some of the weight and make sure the patient doesn't fall during ambulation. Assisted ambulation can help to maintain the current muscle strength and even begin to build more muscle mass. The contraction of leg muscles will help to promote blood flow through the blood vessels, which is important to every part of the body. The bones will retain strength as well because they are being used to hold the body up and for movement. The principle really is simple, and I'm sure you have heard it many times before. Use it or lose it. We want our patients to use it so they don't lose it. That's your goal when moving, turning, and ambulating patients. We discussed your role in helping patients that are immobile. You should now be aware that moving patients up in bed is safest with 2 people and should be done using a slide sheet. We also went over the importance of turning patients and how doing this every 2 hours can help prevent decubitus ulcers or pressure ulcers, which are bed sores. You also know to not turn immobile patients onto their stomachs unless the physician orders this to be done. We now know that ambulation is standing and walking. Assisted ambulation can help blood circulation and maintain muscle and bone strength. The goal is to shorten the period of time during which patients don't stand or walk. Maybe your cell phone or tablet. That makes sense. Those are things that you can use while on the move. That is what mobility is about, movement. Movement or mobility is also a necessity for some bodily functions. This can become very apparent when we have extended periods of time when we are not mobile. You learn somewhere along the line in life that we use our bones and muscles in order to move our bodies from one place to another. Our bones give our bodies structure, and the skeletal muscles move the bones around. When you studied the muscular system, you became familiar with how the different muscles in the body contract and relax to cause mobility of the body. Let's take a look at the mobility functions and then talk a little bit about complications from non-mobility. The contracting and relaxing of skeletal muscles to move the bones also causes other internal parts of the body to move. This is especially true for our blood vessels. You remember the blood vessels are the network of arteries and veins that are responsible for moving blood around throughout the body. Well, when your muscles contract and relax, this squeezes and releases the surrounding blood vessels, which facilitates the movement of blood through the blood vessels or circulation. Blood comes to the heart quicker, making the heart pump faster to keep the blood flowing. This is essentially what happens during cardio exercises. Now that the heart is pumping faster and the blood is moving quicker, this really helps with circulation of blood so that all parts of the body are able to get oxygen and release waste more efficiently. The contraction and relaxation of the skeletal muscles also helps to increase the activity of another type of muscle in the body. The brain will realize that energy is being used when the muscles move, which makes the brain send signals to the GI tract for it to digest food for conversion to energy. The smooth muscles in the body begin to contract more since they are responsible for doing things like moving food through the GI tract. Recall that these muscles work by a series of circular wave-like contractions called peristalsis. Another way mobility helps with peristalsis is simply because using muscles helps to maintain muscle tone. The more toned the muscles are, the more effective they will be when they are contracting and relaxing to move food or other substances around in the body. The increase of circulation gives the muscles that carry out peristalsis the oxygen that they need to work better too. So it should become a little more apparent now why mobility is very important to the body. As with all important things in life, the absence of mobility can lead to some very uncomfortable occurrences in the body. Let's start with the most obvious complication first. You may have heard the statement use it or lose it before. This most definitely applies to the muscles. If a person is not mobile for a week or more at a time, then the muscles will start to become weak and shrink. This makes it more difficult to resume using the muscles when and if mobility is restored. The bones will also begin to break down if they are not moved around regularly. The bone will become brittle and prone to the development of osteoporosis. The joints are susceptible to developing contractures, which are deformities due to the loss of elasticity in tissue. You have to remember that the joints are held together and attached to muscles for movement by tendons and ligaments. These are normally elastic in nature. If they aren't stretched and relaxed, though, they will lose elasticity just like an old rubber band that sits around and doesn't get used. As soon as you stretch it, it will snap. Now let's discuss the not so obvious complications. Hypostatic pneumonia is pneumonia that develops due to fluid building up in the lungs as a result of weak chest muscles and lack of coughing. Yes, the muscles in the chest can become weak, too, when a person is immobile. The chest muscles are responsible for coughing and clearing the airways of the lungs. When these muscles are weak, they can't cause a productive cough, and the fluid sits in the lungs. Eventually, infection will ensue and pneumonia will develop. There are other parts of the body where fluid gets trapped when a person is immobile. Retained secretions, or secretions not released by the body, can occur in the urinary and GI tract. The peristaltic contractions of the urinary tract slow down when mobility stops. This causes the urine to be retained in the urinary tract. The bladder loses muscle tone and will not contract fully to release its contents. What is released from the bladder will leak out more so than come out in a controlled manner. The slowing down of peristalsis in the GI tract makes waste move slowly through the tract. Water is still removed from the waste at the same rate as normal. This creates a stool that is hard and difficult or impossible to release in a condition known as constipation. In severe cases, fecal impaction can occur if the feces sits for so long that it causes a blockage in the colon. We discussed earlier that mobility increases circulation. You can infer, and would be correct to do so, that lack of mobility decreases circulation. A decrease in circulation decreases the amount of oxygen available to the body. The blood pressure will drop when circulation decreases, and this poses problems with kidney function. A person will develop a drop in blood pressure when they stand up and attempt to move around in a condition known as orthostatic hypotension. The low blood pressure allows blood to move so slow that blood clots form and blood can leak into surrounding tissues, causing edema. A final complication of lack of mobility is decubitus ulcers. These are sometimes also called pressure ulcers or bed sores. This is the breakdown of skin tissue due to the lack of oxygen supply. These happen when circulation is cut off by the body's weight pushing down on the blood vessels that serve a particular area of the body. They will occur in the areas on which a person is lying that are bony, such as the behind, heels, elbows, and hips. There is so much going on in the body when we move around. Here's what we have discussed in this lesson. Mobility is movement. Mobility helps with the movement of blood through the blood vessels called circulation. It also facilitates a series of circular wave-like contractions called peristalsis. The lack of mobility can create the following complications. Muscles shrink and become weak. Bones break down and become brittle. Contractures, deformities due to the loss of elasticity in tissue. Hypostatic pneumonia, pneumonia that develops due to fluid building up in the lungs as a result of weak chest muscles and lack of coughing. Retained secretions, or secretions not released by the body. Constipation, a stool that is hard and difficult or impossible to release. Orthostatic hypotension, a drop in blood pressure when they stand up. Decubitus ulcers, pressure ulcers, or bed sores, breakdown of skin tissue due to the lack of oxygen supply.